unit. Did some work as a co-facilitator for a psychoeducational group with mothers whose daughters had been sexually abused by their fathers. And I co-facilitated with a psychologist with that group. I did about 5 years of community and economic development in Kansas City, and what we did there is we had individual development account programs, so we helped start that up for low and moderate income Latino and African American communities in Kansas City, Missouri, and Kansas, and to help folks purchase homes or renovate, go to school or trade school or college, and start or expand a small business. So I did that for 5 years, and with that I've also we did research for 5 years following a longitudinal project, and we also did policy practice. We got the community involved in getting policy passed that would help fund these IDA projects. So we brought community members to Jefferson City, Missouri to provide testimony in front of the legislature. We did a lot of letter writing or postcard writing campaigns, phone calls, things of that nature. And we did that on the state level and the federal level, which meant bringing participants out to Washington, D.C. and meeting with legislators as well. So that was a lot of fun.
Yeah.
Yeah, and I've continued that as I've gone into the academia, and I continue to do research on anti-poverty policy practice and the research. So I do that as a researcher, but I also do it as a teacher, and I teach social policy and social work practice with communities and organizations. I've also taught practice classes. I'm also serving as the MSW program coordinator, and so part of that is recruitment and retention of graduate students like yourself, and also working with our accrediting body to make sure that we're doing everything we need to be doing for our students and for our school. And I'm also the director of the school, which has its own hat of administration as well.
It kind of makes me smile just because the range is very wide, and that's what I most love about social work, is the latitude that you have, and the fact that in our profession people are expected to change their jobs. Frequently we deal with very difficult social issues sometimes, and so people need to switch issues and to switch the settings in which they work sometimes, just in order to stay fresh and current. So my first job was at BA level was as a case manager, working with adults with serious and persistent mental illness. I also worked as the director of adult day services for frail elders, Rape Crisis Center, doing community outreach and education, and also providing direct services to adult survivors of sexual assault. Later, certainly just working as a therapist in a community mental health center, doing inpatient and outpatient work. Worked in a children's psychiatric inpatient unit. Let's see, what else? Had recent opportunity to work in disaster relief work as well. I've been teaching, so I would add social work educator to that. I've been teaching for a good number of years now. Let's see, am I remembering everything? Well, you can see it's really a wide range of things. Therapeutic daycare center with abused and neglected, or a therapeutic preschool working with abused and neglected children. So everything from gerontology to preschool, and working at all levels within that.
Yeah.
I can say one thing that, I don't think I've ever had a job where education wasn't a big piece of it. It was, you know, a major function of the social workers in every one of those settings.
Well, I've done a lot of different things. I worked in residential treatment with kids who've been removed from their home because of emotional issues or because they've been abused and couldn't be in the home. I've worked in medical hospitals doing discharge planning. I've worked in psychiatric hospitals, mostly with children and adolescents, although I've done some work with adults. I've worked in a mental health setting, community mental health. I've also had a private practice for about 12 years where I specialized in working with people who had experienced trauma and abuse and were survivors of that, anywhere from 2 up to, I think the oldest person I worked with was about 65 or 70. I've worked in domestic violence agency, doing a variety of things there. Worked as a school social worker. So I've pretty much done it all. And then of course I've been an educator and do research and teach, and I've had students in field where I've been a field instructor too.
Much of my experience has been in kind of 2 areas that kind of overlap, has been in medical social work. That being my internship when I was a student was in a hospital setting. So, but in the same sense, my field instructor, I mean, the importance of the field instructor in teaching you, he was very much a clinician. He was very much a mental health provider working in a hospital setting. And that's sort of the image that's been stamped in my brain, is in what he would really, and the other social workers there, is that for a lot of folks in hospital settings, we're the only mental health provider, if you will, or clinical social worker that they come in contact with during one of the most stressful times of their lives. And so that sort of practice mentality is really shaped. But I worked in New Orleans at a small acute care hospital, and then worked at 2, and then I did PRN work for Tulane University Medical Center, which was cool because I went all across. Most of my experience has been in acute care, kind of standard med-surg, oncology, OBGYN sort of stuff. But at Tulane I got to do more working in a NIC unit, a neonatal intensive care unit, which is really neat because it's a different paradigm. It's much more of a, everybody's on an equal playing field, and it's much more of a team approach, you know, with the physicians and the neonatologists and the nurses. I mean, it's a cool, I mean, that was a big influence on me, this team approach to helping people cope with some really dramatic things in their lives. A major effect, another major job that I had that had a big influence is when, after I started my doctoral work at LSU and wanted to keep my skills up. I didn't want to just become a sociologist. As I worked at a diabetes clinic, about 20 hours a week, providing mental health services, but with a medical focus on diabetes. So that was a huge influence and helped shape me. And it was really kind of unique at that time to have a social worker in a diabetes clinic. And luckily the nurse that was the director of the clinic, I really learned a lot from her, and it was kind of her vision to have this interdisciplinary or multidisciplinary looking at the whole person, which falls right in line with what social work's doing. And then I began doing some private practice, seeing mainly folks with healthcare issues, in particular diabetes and mental health. The combination was what I was sort of specializing in, and had a good referral base. And it was just part-time work, but it was I was getting too many referrals, and I had to keep squashing it down while I was going to school full-time. From that, from private practice, and then as a professor, a lot of us consider, being a social work professor as practicing social work. Because you think about, there's counseling involved, certainly not mental health counseling, hopefully, but there's counseling involved, and definitely teaching and educating and helping people grow and to really mature as a person or beyond.